There are two items needing individual consideration today. The first item is considering ratifying a letter sent to Senator Hickenlooper, Bennet, and Congresswoman Boebert to oppose proposed federal rulemaking by the Center for Medicare and Medicaid Services that will negatively impact Colorado seniors. Today we have Doug Farmer, President of Colorado Healthcare Association, here to present. Come on up to the podium, Doug. Thank you. Good morning.
Morning, Commissioners. My name is Doug Farmer, and I'm President of the Colorado Healthcare Association and Center for Assisted Living. We represent nursing home and assisted living providers throughout the state of Colorado, including all of the nursing homes here in Mesa County. And I appreciate the opportunity to just give you some background on this issue and to talk a little bit about the rule and how it would probably most likely impact those that provide care here in Mesa County. So simply put, the rule would require more staffing in nursing homes than currently exists. And we estimate it would require about 1,200 new RN and CNA positions, those nurse aides and full-time RN nurses throughout the state of Colorado. That's a cost of about $60 million a year to add that many staff. But I think the bigger issue here is that those staff simply don't exist. We estimate that we're about 2,500 employees short throughout the state from where we were pre-pandemic. So we need that many nurses to come back into our system in order to come up to the levels that we were at before COVID ravaged the profession. In this rule, not only do we have to have more staff, but we have to have a 24-hour, 7-day-a-week, 365-day-a-year RN on staff in-house. Right now, 90% of rural nursing homes in the state of Colorado are unable to meet that demand. They have an RN there during daytime hours. It's very difficult to get one in the building during nighttime hours. So we use virtual, we'll use a telephone system to be able to reach out to an RN if an RN is needed. I think the point to all this and our concern behind all of it is that placing a requirement on nursing homes to have more staff that simply don't exist will result in one of two things. Nursing homes will have to shut down wings or units within their buildings, or in some instances, they'll simply close. If you have to have a certain number of employees and they simply don't exist, those are the two choices that you're left with. So what I'd like to share with the commission is that you have 615 beds of skilled nursing care in this county. If even one of these nursing homes were to close, that would mean that residents would have to leave nursing homes here in Mesa County and seek care elsewhere. That's a burden for the family and friends, but it's also a significant burden for the individual that's receiving care because they don't get to see family and friends as often as they should. They don't have the kind of quality of life that we would expect. So I would leave you with three things that we are asking the administrator. We're not simply saying no, that's not what we make a habit of doing, but we're asking the administration to consider helping us, partnering with us to try and develop healthcare staff members. Partnering with us to find some financial solutions if and when we can actually find employees to bring into our buildings, and working with us to make it sustainable. We need flexibility in a rule like this. Simply saying that you need, a certain number of hours every day of the week in every single building across this state doesn't work. A one-size-fits-all rarely works for anything, but especially for healthcare. So I appreciate the commission's support with this. I'm glad to see the letter that you sent through. We're encouraging Congress to push back on the administration. There's a bill moving through the U.S. Senate and another through the U.S. House that would prohibit the rule from becoming final until a certain number of measures were met. So I'd be happy to answer any questions you might have about nursing homes or this rule or anything else that I might be able to assist with. Thank you very much for your time.
Thank you, Doug. Do you guys have questions or comments?
I have comments, no questions, but this is very personal to me. We put my dad in a nursing home several different times over the last couple of years. And the last time it was about a 2.5 week wait to get him in. And so if this were to pass, if these rules were to be changed, that could make it a 1 or 2 month wait. Or he goes to Delta or Montrose or Glenwood, and none of those answers are appropriate. And I never felt in any of those nursing homes, we had him in 3 different ones. I never felt he didn't have enough staff. There were days when people called in sick. That's going to happen regardless of how many you have on staff. But I'm glad to see you brought this to our attention. I had no idea this was happening, and I hope we're able to help push him in the other direction. So thank you.
Thank you very much.
Just one question. Is there an actual problem they're trying to fix? I mean, I know you don't have enough, there's not enough employees to fill those positions now that they may require, but is there a problem that they're actually trying to fix?
Well, I think that's in the eye of the beholder a little bit, but I do think that CMS, the Centers for Medicare and Medicaid Services, they have always been pushing for more staffing in all healthcare settings, not just nursing homes, but also hospitals and clinical settings. But the issue is, like Commissioner Rowland brought up, I think if you have a nursing home, say, that has your sort of typical elderly or disabled resident there, you may be able to get away with sort of a middle of the road staffing complement. But if you have a nursing home that's full of younger people that have maybe behavioral health issues or have some severe dementia or cognitive issues, you need relatively more staff to do that. And it's a requirement right now that we staff up to meet the needs of the residents that we have. So it's a recognition that there's different needs in different types of communities that's missing from this now.
Okay. Appreciate your time.
Absolutely.
I think they were well intentioned.
Yeah, sure.
Wanting more staff is a good idea, and all things being equal, if we had the 60 million, because most people in nursing homes are on Medicaid. So if we had the money and we had the staff, great, but we don't have either. So
Sure. And it only pushes the cost of healthcare even higher. as well.
Higher.
It's already
Mhm.
expensive. So
yeah.
Fact, yeah.
Yeah, I think anytime that we set the price or we do these unintended regulations, we really decrease the quality and the supply. And so just thank you for bringing this to our attention. We really appreciate it. We care deeply about our seniors here in Mesa County, and this would have a huge negative impact. We couldn't go without even one nursing home operating. And so I think people want to take care of our seniors, and we might have a different way about going about it. I serve on our workforce board and a lot of economic development boards as well in our community. And it is a complex issue, but it starts from a ground up approach where we invest in education, we invest in the workforce, and that's where you can produce people to actually take those jobs. And so opening up those barriers, I think, is better served and will have a better outcome that everybody can agree to. So thanks for bringing this to our attention.
Yeah, absolutely. Thank you for the attention to this matter, and thank you for allowing me the time to speak to you.
Thank you, Doug. I appreciate it. Is there any public comment on this item? Okay, seeing none, I'll entertain a motion to approve the item as entered into the record.
so moved.
Second.
All in favor?
Aye.
Aye, motion carries.